Hi, everyone. Thank you for your attention and time. My name is Soumya Shukla, and I'm the co-founder and CEO of Dectrocel Healthcare and Research Private Limited. In August 2020, we founded Dectrocel to work on issues that really impact a large number of people. India has 1.3 billion people. 1 in 5 suffers from a chronic disease, and most of these diseases do not have major symptoms in the beginning. But the fact that they impact the poor disproportionately, it really is imperative to diagnose these diseases early on and enable early treatment. The problem is further aggravated because of the acute shortage of trained medical professionals. The WHO recommends 1 doctor per 1,000 people. In India, we're looking at an average of about 1 doctor per 11,082 people. And this ratio sort of gets worse when you look at states like Bihar and Uttar Pradesh. So we sort of looked into how we can use technology to enable early detection, address issues of misdiagnosis, and bring in accessibility of specialized level healthcare and address affordability issues. So we built comprehensive medical imaging AI solutions. We have 2 products. The first is DecX and the second is GeneDec, where we're trying to revolutionize early detection in respiratory abnormalities and genetic disorders in children. And what that particularly means, we'll get to the specific just in a couple of minutes. But the bigger question, why we think Dectrocel's AI can make the biggest health impact in pulmonary disease diagnosis in India is because currently we're pinned at 1 pulmonary radiologist per 125,000 people, and we're just doing better than Indonesia, Ethiopia, and Tanzania on the global landscape. Now, the conventional diagnostic solutions essentially are that a radiologist would look at the chest x-rays, but we think there is a huge limitation in terms of the number of chest x-rays that a radiologist can essentially look at in a day, considering the skewed doctor and patient ratio, and also in terms of accuracy, because an artificial intelligence algorithm can look at the same chest x-ray image in millions of ways just in a couple of minutes. So that's where we're coming in. This is DecX, which is an AI respiratory diagnostic tool where analog and digital chest x-ray images are uploaded, and in 1 minute, the algorithm is able to identify 18 chest conditions, which also some of which have significant mortalities like lung cancer, tuberculosis, COPD, ILD, and of course, pediatric pneumonia, which is one of the biggest killers in children. Just to point out the differentiation, the algorithms at Dectrocel are compatible with both X-ray machines across categories in India. 75% of the healthcare infrastructure in India does not have a GE or a Shimanzu or a Siemens. It has local digital X-ray machines. So we're compatible with that. And also we work with similar accuracy with X-ray machines in some of the best hospitals of the world. Also that we're able to process analog X-ray images, which can be clicked from your mobile phone and uploaded, and the doctor can get the result right away. We also quantify the severity of the disease, which essentially means that if somebody has, let's say, pneumonia, we also will give you the severity score, which is 20% or 80%. And for both these severities, the treatment pathways look very, very different. Okay. So in terms of the regulatory pathways, the algorithm has been trained on a comprehensive data set of 5 lakh patients across different populations, and with corresponding ground truth and for every condition, and against 3 board certified radiologists as a reference standard. It is in accordance to software as a medical device process, and we have been this has been performance tested in some of the best hospitals at India, like Sanjay Gandhi Institute of Medical Sciences, and of course across population sets where we knew the ground truth, and benchmarked against the existing algorithms in the market. We have documented POC studies, white papers, and research papers around this, and we've had a comprehensive market validation. So we're now ready to monetize this in the Indian market. From a global standpoint, we're on track of filing the FDA and CE certifications once we have the monetary bandwidth to do that. The other product that I would want to introduce to you is GeneDec, but before I do that, let me introduce to you Bhargav. This is Bhargav, who's a very normal looking child, but he has intellectual disability because he has a genetic disorder which is called Down syndrome. And for the longest time, this little kid has remained undiagnosed. for the multiple times that he was taken to a pediatrician by his parents, he got back home with a very normal diagnosis, with the pediatricians telling his parents that everything was okay. So this clearly points out to the huge missing genetic component in terms of training to the pediatricians, not only in India, but also globally. There are about 300 million people in this world who have genetic disorders, and 50% of them are children, and many, many more who are undiagnosed. For people who've gotten their diagnosis, it's taken about 5 to 7 years. The worst is that for 95% of these genetic disorders, you do not have an FDA-approved drug. So it becomes imperative to sort of diagnose these genetic disorders early on so that you can have preventive medicine in place. Even the strongest health systems in the world, like United States, have just one genetist on 500,000 people. In India, we have about one genetist on 10 million people. So the conventional diagnostic solutions for diagnosing genetic disorders essentially are that a baby is taken to a pediatrician, who of course is the first point of contact. But it is unfortunate that pediatricians are not trained to diagnose genetic disorders. And that's where we're coming in. This is GeneDec, which is an AI genetic disorder diagnostic tool in which the picture of the child is uploaded, and in a few minutes, the algorithm is able to identify genetic disorders. So we're organically building this product as of now. We're building more white papers and research studies around this, and also we're taking more customer insights before we launch this in the market. But this is in the pipeline, and this is our double down growth strategy as we upscale DecX in future. So the market opportunity here is for the first product that we're monetizing in the market. We're looking at a phenomenal market opportunity. We're looking at 7.45 billion as the global X-ray imaging market. And when we look at the SAM, it's at 5.25 billion. For now, we're looking at an addressable obtainable market of $1 billion USD. The market competition for DecX is DeepTech and Cure AI, both Maharashtra-based companies, but I just pointed out the differentiation to you as well. We're compatible across X-ray machines in India, India being one of the largest markets in healthcare, and we're processing analog images over the phone because the current workflow in India requires that the doctors want to see it on their phone. They do not want to download it from the integrated PACS systems because the healthcare facilities in India are just overburdened, and it really makes sense that this is provided as point of care or at the site where doctor is looking at the patient. We really think that we're the right team to execute this vision. Ankit, who has also joined me on call, and also Nikhil, is the technical founder, and he's a doctorate in AI in medicine from Queensland Medical School, Brisbane. He's also an MS in infectious diseases from NUS Medical School, Singapore. His research has been published and cited in one of the renowned journals of medicine like Nature. Nikhil is the CTO. He's a researcher in AI and machine learning from IIT Kanpur. I'm a doctorate in public health from one of the premier institutes of medical education in India, Sanjay Gandhi Institute of Medical Sciences. And also I've worked on a lot of public health projects at the state level with the government. So currently we're at a post-POC stage and screen about 5,000 to 7,000 patients. And out of those patients, we're seeing an accuracy of about 98%. So the business model of the company is very straightforward and simple. We're looking at a pay-per-use model and a subscription model. And in the first year, we intend to activate 50 sites. We already have 5 expression of interest from diagnostic centers at Lucknow. We're also in documentation for a public health screening program with the government of Uttar Pradesh for tuberculosis. So getting back to my numbers here, we intend to activate 50 sites in the first year, and that would, assuming that per site we'll have 20 scans per day, we would generate revenues of about 3.8 CR in the first year. And if we're able to sort of achieve this milestone with narrow execution and credibility, we'll upscale and replicate that to 2x and 10x times in the second and third year. And this multiple definitely would depend on the team capabilities. The stronger the team, the more the multiple. When we look at the unit economics, we're looking at about 80% margins per sale. And it's difficult to understand what the CAC is going to look like right now, but we should see gross margins somewhere between 40 to 60%. So the go-to-market strategy is essentially to be able to bring doctors, hospitals, diagnostic center, radiology centers across geographies on board with us. They would not only be our clients, but also act as influencers in terms of educating about the product in the market, and also partner with larger institutions who can help us enter their distribution channel. At this point, let me tell you why Dectrocel is going to be profitable. So this is what my monetization strategy looks like. So we're based out of Uttar Pradesh, which has a population of about 25 CR. It's one of the largest contributors of tuberculosis in India, also has a large caseload and mortality in respiratory abnormalities. So this sort of translates into a business opportunity of about 1,000 CR. And essentially the monetization strategy would be to deploy this in diagnostic centers across the state. And diagnostic centers are of three categories. One, of course, is the small diagnostic center, which will give us scans below 20 per day, and the medium-sized diagnostic center and the larger diagnostic center. The medium ones would give us on an average of about 50, and the larger diagnostic center, we look at DecX as being a triaging tool there. Also, to deploy it in hospitals which don't have pulmonary radiologists, you have primary healthcare centers, you have district hospitals, you have community hospitals which do not have specialized level healthcare facilities. You don't essentially have a radiologist there. Even a lot of hospitals in the urban area do not have essentially specialized pulmonary radiologists. So those are all places where we will deploy DecX. Also an assistive tool for 10 lakh Ayurvedic and homeopathic doctors who are there across the state of Uttar Pradesh. In the rural settings, as I mentioned, in primary healthcare centers, community centers, and district hospitals, as a triaging tool in the overburdened healthcare facilities, of course, population health screening programs with the government. We're not only going to be a profitable company, but we're also an investable company, and this is how it is going to happen. So building data repository, because data is the new oil. And while many international companies want to build innovations around products, they would require data. So right away, we're going to put data repository functionality in our platform. And of course, leveraging of R&D facilities with us once we crack the distribution systems across India. And of course, as I presented to you GeneDec, that is going to double down on our growth strategy in terms of innovation in future. So this is what accelerates our revenues. And we're asking for a fundraise of 1.8 CR. And this would essentially be invested in sort of building extensive inbound sales teams, because you would echo that this product requires a lot of explanation, and then into marketing, patents, and R&D and white papers, because healthcare sort of is definitely an industry that requires R&D for a long time, and into capital expenditure. This is sort of a low capex business model. Operations and then legal and CA services is what we're going to be spending our money on. And just to give you a background of some of the recognitions at Dectrocel, we are the market access winners from the Quebec government. So we will be taking our product to Quebec and understanding how we can co-create algorithms in healthcare in their space. And also we're the winner at ASSOCHAM Lucknow. We're also winners at Startup UP Startup Conclave. We're incubated at IIT Mandi Catalyst, also at MedTech Center of Excellence at SGPGI. We've been selected for Startup India Seed from BeamTech, Atal Incubation Center. And yeah, so that's it from my side, and we'll be happy to take questions. Thank you.
Great pitch, Soumya. Thank you very much for this. So now I'll open up this for the questions. I have first question from Amar. So Amar, please unmute yourself and ask the question.
Hey, Soumya, great pitch. Just wanted to check. So the technology that you are working on, you already applied for FDA and all, right?
Sorry, Amar, you're not audible to me. I cannot hear you with clarity. Could you just repeat your question?
I'm asking, did you apply for the FDA approval for this technology?
Okay, great question, Amar. So yeah, so we don't require an FDA to launch this in India. We have already clinical validation on our side. We have the white papers. But yes, for expanding globally, we would require to do that. We have all the elements, but we don't have the monetary bandwidth right now. So once we raise funds, that's the first thing that we'll be headed towards.
Okay. And what about the patent?
Yeah, that is in process. Patents are in process.
So you are applying for the patents in US, right?
No, we'll apply for the patents in India.
Why not US?
Requires more money, and since we're based in India, and it makes sense because healthcare is one of the biggest markets in India, right? So it makes more sense to have the patents here.
Okay, so do you have any near plans to offer this technology in outside India countries?
Okay, so we have this offer of market access from the Quebec government, and I will be traveling to Quebec in, let's say, August and September, and then I'll have a better understanding of how we can look at global expansion from the standpoint of offering our technology. At this point, from the global standpoint, we're looking at data as being the new oil for us. But I'll be in a better position to answer that question once I'm there and I come back.
So this will be Canada.
This will be Canada, yeah.
Understood. Okay, and just want to know, so what is on offer for this how much 1.4, right?
Yeah, 1.8 here, yeah.
1.8. What is the offer?
Yeah, so we're looking to dilute about 12% of equity, which is negotiable.
Understood. Okay. Okay.
Thank you, Amar.
That's all from my side.
Great. Thank you, Amar. Thank you for the questions. Sai, you have any questions? Because I see you have raised hand. Yeah, go ahead.
So my first question is so is there a need for a second opinion post this, or is this like just a preliminary screening kind of a thing?
Yeah,
that's right. This is a preliminary screening tool. And also,
so you definitely need a radiologist, right?
No. So yeah, just to quickly come on that. So essentially, so let's just understand this with an example. So if it is a primary healthcare screening healthcare facility, therein what will happen is that the patient goes in, chest X-ray is very good. I mean, it is all across rural area, everywhere there is a chest X-ray machine, but they do not have reporting system. Okay, so what happens is that if this reporting system comes into play, so let's take another example. So the person goes into the primary health center. There is no radiologist, of course, but there is a general practitioner there, right? If he gets an indication that pneumonia is there in this patient just because based on the reporting, so what he will do is he will on just based on that reporting, he will start the antibiotic treatment, and he will refer the on follow-up with a specialist or whosoever pulmonary specialist whenever so the patient has time, or maybe that report will be then sent to the urban area or wherever the specialist sits for further clarification. But the point, like, this treatment can start happening. Second point is that look, radiologists or pulmonary radiologists are trained into different fashions. So radiologist is a person who can look at all kind of like chest X-ray, MRI, PET scan. So he is not like a specialist, but pulmonary radiologists are only who look at pulmonary diseases or respiratory diseases. So here radiologists may be trained on one or two diseases, maybe. So radiologist training is like how much experience does he have, how much training has he had on those kind of cases. But here we are diagnosing 18 respiratory conditions. So maybe he's trained on 3 or 4, maybe 10 conditions, maybe not all 18, but the algorithm is trained in a manner that it is shown like just exactly how a radiologist will be trained. He will be shown X-ray. These are the signs that you get on the chest X-ray, based on which you will be reporting. And exactly in the same manner, 5 lakh of the chest X-rays are distributed. This is the disease conditions, and then 5 lakh are normal. So basically the algorithm gets trained on these special 18 most occurring diseases, chest conditions in India. So that is how it is. And so your question would be like, okay, in facilities where the radiologist can only see 20 chest x-rays a day because he's very busy person, so what can happen is that this tool will act as a triaging tool, basically prioritizing those people who really need it. Because let's say 100 people are coming into the facility, this algorithm can do these reporting within a matter of 2 minutes. So basically, even before the radiologist or the chest pulmonologist comes in, they will be already prioritized based on who needs the because in the facility there may be normal people who are just thinking that, okay, I have something, I need to see a doctor, but they really don't need to see a doctor. Maybe there is somebody who really needs to see a doctor, so there it will be acting as a triaging tool. So you need to understand, based on the setting or the scenario, this tool changes its role. Somewhere it will be just a diagnostic tool, somewhere it will be a triaging tool, and some places it would be like an assistive or a second opinion.
Great. I hope this answers your question, Sai.
Coming to my second question, so like in a hospital or a diagnostic center perspective, what would be the kind of cost cutting if it goes through this means compared to hiring a radiologist on an hourly basis?
So you will have to repeat that. Sorry, what was that again?
Yeah. So like, let's say usually like hospitals, like if they have more X-rays coming in or if they have more patients coming, they hire temporary radiologists, right, at an hourly basis.
Yeah. Well, so the thing is, it's about the cost. As you can see, we can deliver in 100. Consultation of a good radiologist will cost you anywhere upwards of 1,000 or maybe 500 at least. And he will also give you the same kind of indication whether these 18 are present or not. And and that's it. And based on that, the treatment would be written by the referring doctor. Treatments are never written by radiologists. Treatments are always written by the referring doctor.
And coming up with a pilot project with the UP government, so how is that going to work and what kind of an impact would it?
Yeah, let me take that question, Ankit. So we're in the process of documentation with them. So as you know that India contributes for 20% of the tuberculosis cases here. So the digital transformation in UP has happened. We have a digital X-ray machine at the community center, at the public health center, and also at district hospitals, but we don't essentially have radiologists. So the government essentially has a mandate to now not run mobile vans, but actually enable engagement with the patients from these facilities. So, putting this algorithm setting there, and whatever cases of tuberculosis that are pointed out by the algorithm then would move into the DOTS program.
Yeah, last question, in your clientele, it was written that Apollo is one of your customers. So are they using it in those rural franchisee-based model clinics, or where exactly are they using it, and what was the reaction from them? What was the response?
Your voice was cracking up. You'll have to repeat that question for us.
Yeah. So in one of your clientele thing, I saw that Apollo was one of your customers. Apollo Hospital. So how exactly are they utilizing your technology? Is it in the rural side, or where are they using it, and what was the reaction to this, and how exactly was it used?
Oh, great. Thank you for that question. So Apollo Hospital and Google Brain team have been our R&D partners. So we have essentially worked with them for annotating data, which was used by the Google Brain team to come up with the research on tuberculosis. So they've not essentially been our clients in terms of deploying the technology, because that was at an early stage that, while we were building the product, they were our clients and not at this stage.
Done, great. So there is another question from Aditya Jain. He's asking 1.8 crore at what valuation? So Aditya, 12% is what have been proposed by the team of the startup to dilute, but it is still like we are yet to finalize this final valuation. So that would we'll put the campaign up on the platform in next week with the final valuation. I hope this answers questions. If there is any further question, you can raise your hand.
Ganesh, there's a question from Sagar.
Let me take it. Yeah. Sagar, if you're there, please unmute.
Yeah. So I just want to ask one thing. How many companies in India are doing the same sort of product that we are doing in radiology? So see, we had been on a call with 𝐞𝐚𝐫𝐥𝐲 Capital Analytics last week. What I understand is they are mainly focused on the US markets and the Europe markets. Deep Tech, I'm not sure of the product that they are into. So I just want to wonder what is the competition landscape like in India for us?
Yeah, thank you for that question, Sagar. So we benchmarked 𝐶ure.ai as a competitor, but as you rightly pointed out, that their strategy is more towards the markets in the West. So we're looking essentially at deep tech. So the market penetration for AI algorithms in India is a little low, and that also gives a lot of opportunity. However, I think 𝐶ure.ai is doing the population health screening programs in Haryana, in Maharashtra. They're doing it. And I think their strategy keeps changing from time to time. So at this point, we're only looking at 𝐶ure.ai and also deep tech. I haven't known of somebody which is making a dent in the respiratory abnormality space or genetic disorders as of now, except people in the West. You've got Phase 2 Genie as a competitor. It's a Boston-based startup in United States.
But do these guys also do radio imaging as well as gene tech?
No, they don't do. They're specifically in the genetics landscape.
Got it. Thank you so much.
Okay.
Yeah, great. Due to the time constraint, we'll have to move with the next startup. Thank you, Soumya, for being here and pitching the idea.